Hello, everybody. I am Dr. Heather Wisely, Doctor of Acupuncture and Chinese Medicine, and today I am going to talk to you about using acupuncture to treat headaches and migraines. Now, not only am I going to talk about if acupuncture works to treat headaches and migraines, but I'm going to answer the other most common questions people ask me when they're seeking out services. These include, how does acupuncture work to relieve headaches and migraines? How many treatments are going to be needed? Some people want to know if it's safe during pregnancy, what are the long-term results of acupuncture, and if there's any other options besides acupuncture to help effectively treat headaches and migraines. So if you've been wondering any of these questions, about acupuncture, then this video is for you. So let's dive right in and talk about if acupuncture works for headaches and migraines. To answer this question, I jumped in and I looked up several meta-analysis and systematic reviews, and I found more than 7 systematic reviews and meta-analysis that unanimously concluded that acupuncture outperforms Western medicine alone. Now, these different reviews included over 170 randomized controlled trials, and they employed over 20,000 participants. What they found, as I said, acupuncture does work better than standard care alone. Not only that, but people who were using acupuncture also found that they had a lower reliance on medication, and there were less side effects for acupuncture than standard treatment. So yes, acupuncture does help to relieve headaches and migraines for a lot of people. So how does acupuncture work? There have been a lot of randomized controlled trials answering this very question. So I found a few that used both fMRI studies, fMRIs, and heart rate variability analysis, both before and after acupuncture treatments. And what they found was that acupuncture relieves headaches and migraines by restoring the neural pathways. It regulates the way that we perceive pain in the brain. And not only that, but it regulates our autonomic nervous system, which is the part of our immune system, the part of our nervous system that is related to fight or flight and is a trigger for a lot of people with migraines. Now, how many treatments will be needed? Headaches are a little easier. So looking at migraines, I went through 6 different controlled trials that effectively used acupuncture to relieve headaches and chronic migraines. And I found that they employed anywhere from 12 up to 20 acupuncture treatments that ranged anywhere from coming in once a week and up to 5 times per week. And these were the studies that really effectively relieved pain for people. And I have found that to be true in my personal practice as well. It often does include a course of treatment. So is acupuncture safe during pregnancy? This is a really big question because there are not any really great treatments treating headaches and migraines for women while they are pregnant. So the answer is yes. Acupuncture has been shown to be perfectly safe during pregnancy for a variety of conditions, but it has been studied specifically with migraines, and they found that acupuncture really did help women. Not only that, but acupuncture also helped with the related symptoms of nausea and vomiting, so we kind of get extra benefit there for women. There are a few points that are contraindicated during pregnancy, but all of the studies found that when acupuncture was performed by a licensed acupuncturist, that there was no harm done to this fetus at all in relationship to acupuncture treatments. So what are the long-term effects of acupuncture? I found one trial that had a long-term follow-up, and what this trial did was they took 150 people and they divided them into 3 groups. Now, there was a true acupuncture group and there was a sham acupuncture group. And sham acupuncture is where they put a non-inserting needle over an acupuncture point so that the person thinks they're getting acupuncture, but what they're really getting is acupressure. So I like to think of sham acupuncture as basically a way of looking at how acupressure works for people. And then they compared these 2 groups to standard care alone. And what they did was they gave both the acupuncture and the acupressure clients 20 sessions over the course of 8 weeks. And then they reevaluated everyone at the end of treatment. At the end of the 20 sessions, both acupuncture and acupressure were outperforming standard care alone by a lot. However, at the long-term follow-up, 12 weeks after the last acupuncture session, what they found was the true acupuncture clients had continued to improve after treatment, and the acupuncture group did not continue to improve. They had the same amount of improvement at the time of the last treatment. So at the end of the study, the acupuncture clients had half the amount of pain than they did when they started their treatments, and half the number of headache days. So this really is much more effective than most medications at relieving headaches and migraines. However, as with any medication, results can vary. Some people will have a tremendous amount of relief within just a few sessions. Some people might need a few treatments to get any pain relief. And once in a while, people might need continuous treatments to continue getting pain relief. And a very few people either don't respond to acupuncture, and some people actually just don't like acupuncture, which brings us into what else can an acupuncturist do? As I mentioned, we can do acupressure. Personally, I like to use acupressure magnets strategically placed on points so that people have lasting relief after they leave my office. And this has worked really great for a lot of people. Not only that, but acupuncturists are also trained in different types of Asian body work, including cupping and a technique called scraping or gua sha. And both of these have been shown to be very effective at relieving headaches, neck pain, and other pains related to headaches and migraines. Some acupuncturists are also trained in traditional Chinese herbal medicine, and there is a lot of different herbal formulas that can help with headaches and migraines. Much like pharmaceuticals, there's usually a daily prophylactic treatment that people will take, and then there can be acute formulas on days that headaches are more intense. So there are over 20 different herbal formulas that are listed as having beneficial effects for headaches and migraines. So it's really important to talk to someone who is trained and licensed in Chinese herbalism before jumping into that. Now, not only are these different techniques effective, but there have been a lot of studies looking at movement therapy as a form of pain relief. Tai Chi, Qigong, and yoga therapy have all been looked at in regards to helping people relieve headaches and migraines. Now, just Wednesday, Stephen jumped on live on our channel, Wisely Living, and uploaded a 15-minute yoga recording that is really helpful for relieving tension in the face, head, and neck. So check that video out. I will leave a link in our description. If you have any other questions about acupuncture for migraines or acupuncture at all, please leave them in the comments section. I will get to all of your questions. I've left several resources in the video description, including a link to my blog post, a link to the studies that I referenced, and if you really enjoyed this video, please make sure to like and subscribe to our channel. If you know anyone that would benefit from this information, please share it with them. And then next week, I'm going to be going live once again, and I'll be talking about using acupuncture for neck pain and jaw pain. So thank you all so much for joining me today. I appreciate your time.